The cat scratch disease. Cat scratch disease, CSD, is a bacterial infection caused by the bacteria, Bartonella henselae. Humans typically contract it after being bitten or scratched by an infected cat or kitten, or if the cat licks an open wound. Bartonella henselae is a fastidious, gram-negative bacterium, primarily known as the causative agent of cat scratch disease. It is a zoonotic pathogen, meaning it naturally lives in animals, primarily cats, but can spread to humans. This bacteria has following key characteristics. Facultative intracellular. The bacterium prefers to live and replicate inside the host cells. It specifically targets red blood cells, erythrocytes, and the endothelial cells that line blood vessels. Fastidious. It is exceptionally picky and difficult to grow in standard laboratory cultures, often taking weeks to show up on a test. Vector-borne. It relies on blood-sucking insects for transmission. Cat fleas spread the bacteria from cat to cat through their droppings, flea feces. In cats, Bartonella henselae is primarily found circulating inside the bloodstream and on the exterior of their fur, skin, claws, and mouth. Because cats are the natural reservoir for this bacteria, they are usually asymptomatic carriers, meaning the bacteria lives inside them without making them sick. How does this bacteria operate in the human body? When a human is scratched, the bacteria enter through the broken skin. Because it hides inside host cells, Bartonella henselae can effectively evade the human immune system for a period of time. As seen in the diagram, it can present in following forms. In following hosts. In case of healthy people, who are immunocompetent. In healthy individuals, Bartonella henselae usually causes cat scratch disease, an infection characterized by a mild skin blister at the scratch site, followed by localized, swollen lymph nodes. Symptoms are typically self-limiting and resolve naturally within 2 to 4 weeks without medical intervention. In case of immunocompromised people. In immunocompromised individuals, such as those with HIV/AIDS or transplant recipients, Bartonella henselae can cause severe, life-threatening disseminated disease. Instead of localized swollen lymph nodes, patients often develop systemic infections, including bacillary angiomatosis, peliosis hepatis, and culture-negative endocarditis. Diagnosis relies on PCR testing rather than antibody tests. If the immune system is weak, the bacteria can trigger abnormal blood vessel growth. This can lead to more severe systemic conditions like bacillary angiomatosis, causing lesions on the skin and internal organs.